looks like we're ready then. So I'll just do a bit of introduction. There are some names and faces that I do recognize here, but many that don't. So if people are sort of wondering who I am, I'm Alan Longcroft. We also have Susan Evans, and we're both on the governing board. And we have Jennifer Norton as well, our CEO, with us. We're joined by Marianne today, who many will know for her wealth of expertise in acupuncture, Toyohari, Japanese acupuncture. If we have anyone joining from Westminster University, then many people will be very familiar with Marianne as a senior lecturer there. And she's going to talk to us today about the benefits for us as practitioners and for our patients about EFT. So I'm very much looking forward to this talk as well. And this is part of our series on anxiety. So we have more talks coming up. You'll be able to watch these on the, these will be recorded and uploaded onto the BIAXI website. So if after today, you'll be able to re-watch Marianne's talk along with all the talks in the conference archive as well. So we have Connie Cooper, Sarah Pritchard, Danny Blythe, and Claire Windsor-Smith coming up as well. So without further ado, I will hand over to Marianne. We'll be saving up our burning questions in the for after the talk. So feel free to all use the raise your hand function at the end, type your questions into the chat box, and we'll try to get through as many as we can. Okay, over to you, Marianne.
Lovely. Thank you. Thanks. Good morning, everybody. It's a little bit strange because I can't see you all because I've actually got my PowerPoints in front of me. So normally I would kind of get a lovely gallery view of all the participants and people that I recognize. So sadly, I don't get to see that. But just wanted to say good morning and just to say what a privilege it is to have been asked by the BIAXI to actually start this series of webinars. And actually I had suggested doing a session on tapping and on anxiety before I even knew that that was the theme. And yeah, it just feels a little bit of an opportunity to be able to give something back, both to the BIAXI, who've been so wonderfully supportive over the last few months, and also to the membership. And certainly at the start of lockdown, I'm sure like a lot of you, you know, there was almost a sort of feeling of shock to suddenly find from one day to the next that we weren't able to practice. And as an EFT practitioner, which I kind of incorporate into my practice and have done for the last 10 years, as well as actually sometimes just doing EFT as a standalone therapy, it immediately sort of came to me that actually this would be a great opportunity to be able to connect with people and connect with colleagues. And I started out quite early on. I did a series of, I think, 3 webinars that I kind of offered to various peer groups that I'm involved in to sort of do some group tapping. And I found that people were really positive and felt that it was really, really helpful to them. And since then, I've basically been doing a weekly tapping session that has been open to patients and practitioners. And interestingly, it's been quite a lot of practitioners that have joined and have found it, as I say, really helpful to kind of try and navigate their way through all the uncertainty of the last few months. So what I'd like to do in this session is I'm going to do, for those of you who don't know about EFT or have never done it before, to do a kind of introduction. And then what I'd really like to do is actually to do an experiential session, because I think the best way that you can understand about tapping is to actually experience it for yourself. So it's not really a kind of theoretical model, it's very much a kind of experiential model. And I felt that so many of the themes that we covered over the last few weeks really did kind of come back to things around kind of anxiety, and particularly just the fact that we are, as everyone keeps saying, living in such kind of uncertain times. Just when we think we're kind of getting our head around one set of circumstances, then literally from day to day it's changing. We are very much kind of creatures of habit, which can be very positive, but it can also kind of work against us. And I think certainly at this time, that need for stability and for things to kind of be the same has actually been proving very, very challenging. And also I think we've all experienced lockdown in very, very different ways. So there have been lots of kind of positive aspects of it. Certainly for me, stopping was really kind of traumatic, but also I suddenly felt like I could breathe a little bit and realize just how much rushing around I was doing. And in a way, it really has been an opportunity to kind of take stock and to reflect on all different aspects of our lives. And certainly I know lots of people who've made kind of quite big changes or decided that they want to start making changes either in their professional life or their personal life, home life. So it's kind of how we can navigate that. And I'd really like at the end of this session for you to feel that you've had a little taster of a tool that you can use for yourself, and also you can teach, or actually not teach, but actually you can maybe signpost patients to use, because there's a lot of material out there, and I will mention that. But one thing I would like to say is that in order to become an EFT practitioner, there is actually a whole training program and case studies that you have to complete. And that actually is a very powerful tool. So rather than thinking that after a 1.5 hour webinar, you can go and start using it with patients, I would ask you to err on the side of caution, because actually strong feelings can come up very quickly, and you need to know as a practitioner how to manage and deal with that. So there's just a little kind of sort of health and safety pointer there. Okay.
Okay.
So whilst Jennifer's just organising the second screen, the second slide, and we can kind of move a little bit through this a little bit more swiftly. Yeah, no, that's fine. Basically, the one before. So EFT, the acronym is EFT, Emotional Freedom Technique. It's also known as tapping. It's called energy psychology technique. Some people call it acupuncture without needles, which I'm not kind of too sure about, because it is actually a standalone therapy in its own right. I'm not even so sure about the title emotional freedom technique, because it's not actually about being free from emotions, because that's kind of part of what makes us human beings. But it's more about how we can, in a way, free ourselves from being stuck with certain emotions that are in some way either not serving us well or holding us back, or basically just stopping us kind of feeling kind of comfortable both on a physical and emotional level. What we actually do is we tap on acupuncture points, so we are actually stimulating the meridian system. If we go to the next slide, which we can pass by, which is what I already said we were going to be doing in the session. It was actually discovered and founded by a psychologist, Roger Callahan, in 1979. And the system that he developed is something called thought field therapy, which is a little bit more specific, where for different conditions, they tap on different meridians. But a little bit like, you know, all our sorts of stories about how acupuncture was first discovered. He discovered EFT, or developed it, by working with a patient who had a phobia for water. And he had been working with her, I think, for about a year and hadn't really got very far. And then one day when he was working, he was working with her, he basically asked her to sort of say, where did she feel this kind of fear when she was feeling this fear about water? And she said that she felt it as this kind of knot in the pit of her stomach. And apparently he had studied quite a lot about acupuncture and the meridian system. So he thought, okay, let's just go to one of the points at the beginning of the stomach meridian and just get her to actually just rub on that point. So I think he kind of got her to rub literally around where one of the points are. We don't do stomach 1 because that would be right in the eye socket, but stomach 2. And what he found when he just got her to do this was that this knot feeling in the pit of her stomach just disappeared. And all the kind of anxiety that she was feeling about this kind of literally a phobia of water had gone. So he took her out, apparently he has a swimming pool, he took her out to his swimming pool, and she stood there and it was like it had disappeared. This kind of feeling of this fear about water just gone. So as a result of that, he then just started to explore and see, you know, how to really just expand that kind of model of this connection between the sort of mind and the body. And we all know as practitioners that actually the kind of emotion, what's going on emotionally and what's going on physically are so interlinked, and that's kind of very much at the heart of Chinese medicine. So Gary Craig, who was one of his students, took the system further and kind of simplified it. So basically created a kind of basic model of how to use EFT, tapping on a certain sort of sequence of points, saying a certain kind of basic setup statement. And obviously now lots of people have expanded that and gone in lots of different directions with it. He worked a lot with Vietnam veterans and therefore worked a lot with quite kind of chronic PTSD. And that's actually even now being rolled out in places like, you know, hotspots in the world, like where schools have had kind of mass shootings and things like that. There's been a lot of work with EFT in those kinds of settings. So can we forward? So as we know, I mean, anxiety is a very kind of broad term, and it can be anything from just general kind of low level worry to very extreme levels of anxiety where it can lead to agoraphobia, to serious phobias, to where people literally almost can't kind of function in their lives. But at the heart of it is just this feeling of worry and nervousness and unease of some uncertain outcome. So I think it's not surprising at the moment with everything that's going on if we have felt some aspect of anxiety. I think all of us we're kind of practitioners, we're mostly self-employed, we're used to sort of hopefully some sort of sense of control over our lives. And obviously everything over the last few months has been very much about feeling out of control and feeling like other people are making decisions, some of which we might be feeling quite angry about, some of which we just kind of feel like it's just totally out of our control. Not to mention anxieties about health, how it's affecting us, whether we've become ill or whether we're frightened of being ill, and people around us. So, I mean, there's a myriad of experiences that we will all have been feeling. But one thing to kind of, I guess, highlight is that anxiety is often around some sort of fear and worry about something that hasn't actually happened. So it might be very well founded on past experiences, and it may be about, but usually it's about some kind of projection of what is going to happen in the future that hasn't actually happened yet. Whereas if you separate it from fear, fear is very much about literally something that is kind of could be happening here and now. So, you know, when we think about the actual flight and fright response, that's usually about an emergency that is literally an emergency that, oh, I can hear some disturbance. Emergency that's happening here and now that we have to react to. So it may be like literally life or death scenario, and then literally everything that kicks in terms of the sympathetic nervous system, adrenaline, cortisol, that is all geared to helping us to survive. But a lot of the time, those kind of hormones are kicking around all of the time, and we're not actually in a life-death situation, but that is how our bodies are responding, because we're kind of imagining that we are in that life-death situation, even if we're not. So what tapping does is it's actually been shown to reduce cortisol levels. There's been research, and I've got some towards the end of this PowerPoint, that has shown that actually when they did some research projects with some people doing talk therapy, some people literally looking at magazines, some people doing an hour of tapping, and the cortisol levels went down anything from between 29% to nearly 50% in some people, which is enormous in just doing 1 hour of tapping. So just literally doing some tapping on yourself, and sometimes you can literally just tap on the points, will help to bring down those kind of cortisol levels. So can we have the next slide, please? So I would like to go in, because I know we are running late and all the things we've been knocked out of the of Zoom and things, is that I would like to actually go into just introducing the actual tapping format. And then what we'll do is we'll actually do some tapping ourselves. And what I'd like to do when I've been doing the sessions over the last few weeks, I've set kind of little themes around them. So for example, the last one was about being good enough. We've had ones on just sort of literally on anxiety, on setting goals. And just as by way of a little example, somebody who's attended literally just 2, I think, of my group tapping sessions recently, I don't know if she's here online, she fed back at the last session that for literally, I think she said 50 years, she's had these family members who every time she meets them, she gets anxious, she feels a little bit inferior, she feels like she's not good enough, she feels like she doesn't dress as nicely as they do, and just has all these kind of negative feelings about herself. And she said after she did that kind of first group tapping session, she met these people, and she just said it was a completely different experience. She felt completely differently about herself. She was able to enjoy the encounter and just didn't have all that kind of negativity going on. So when we're tapping, we're really looking to sort of identify what are the particular issues, main themes for us. And we start off by, and I'm going to kind of show it to you, and then we'll actually, the next slide I think shows you what the kind of main points are. But we start off with what's called a setup statement, and that means tapping on the side of the hand around the sort of small intestine 3-4 area. And we start by literally saying, even though I feel X, or it may be a pain, and it's like, maybe even though I have this, you know, deep ache in my, you know, right lower back or something. And we follow it with an affirmation that says, and the basic one is, I love and accept myself anyway. And we do that 3 times. And I remember when I first started doing this, I was really squirming, and I thought, I can't get people to say to themselves, I love and accept myself. It's so American, sorry for Americans, or it's just like, so doesn't, you know, it felt kind of a little bit almost uncomfortable. And the more I've got into tapping, the more I realized that's so at the heart of what tapping is about. Because not only do we often feel negative about things, or we feel like we have this anxiety, or we're frightened about something, but then we also beat ourselves up for feeling that. So it would be like double negative. It's like, you know, even though I've got all this anxiety, it's like, you know, oh, how stupid, you know, it's like when you make a mistake, what's the first thing we often say? Oh God, I'm so stupid. Yeah, we just kind of beat ourselves up. So the affirmation is really about saying, okay, this is where I'm at right now. This is what I'm feeling. It may be negative, but actually I'm going to accept myself as I am. And sometimes when I've worked with people one-to-one, just saying that one statement makes them burst out crying, because they kind of just realize that actually that is so hard to say, or that they don't really feel that. So just notice for yourself when we do the tapping, what kind of reactions you do have. And then what we do is, once we've done that 3 times, we then go around the actual tapping points. And I think what's really interesting is that in all the kind of things I've read about tapping, they don't really talk about why the acupuncture points are the ones that have been chosen. And I think it's interesting. I was kind of, because I'm always somebody who asks lots of questions, and I was thinking, well, why is it that we're tapping here on the side of the hand? And it's interesting that it is the small intestine meridian, and you know, I'm sure we have all sorts of associations we make with that, but one of them is that sense of separating the pure from the impure, whether it's on a physical level, physiological level, or maybe an emotional level. It's like trying to separate what's important and what isn't, and what is it that we can let go of. So for me, that's the significance of tapping on this point, even though I haven't particularly read that anywhere. And the points that we're going to go to, if you want to just go to the next slide, are basically the beginning and end points of the leg meridians and the governing vessel and conception vessel. As I said, we don't tap on stomach 1 and we don't tap on bladder 1, because that's right in the eye, but we tap on the next point to it. And I think it's interesting because these are either beginning or end points. And, you know, as we know, you know, there is a constant flow of energy through the meridians, and things can get blocked at those kind of juncture points. So that's my kind of explanation again of why we're using those points. I always say to people when we do the tapping that, like, particularly if I'm doing a whole hour of tapping, if it feels too much tapping on all of these points on the upper part of the body, and you start feeling a bit too full in your head, you can go to the Jingwell point. So then that takes you to the other points that are the arm yin and yang, end and beginning points. Okay, so one can go to those points there. And that's also quite useful because sometimes you might be out somewhere and you might be feeling really anxious about something, or something's come up. You can actually just literally go around tapping on these points and nobody needs to even see you're doing it. Or you could, for example, be doing it under the table and nobody needs to see you're doing it. So I've been working long term with somebody with cerebral palsy, a young woman who's actually made incredible changes in the time that we've been doing tapping, both physically and emotionally. And she was having to do a kind of live Facebook presentation. She's also an academic. She just got her PhD. And she basically said, you know, I just literally tap on the side of my wheelchair with my hand and nobody even sees me doing it. So there are lots of kind of lovely pragmatic things that one can do with tapping in whatever context that you're in. So this is the sequence. And as I say, we start off with the points up the side of the hand, and then we go and we literally just tap with the side of the hand. And when I'm going to do the session now, you're just going to mirror me, and we just tap with either one finger. I usually just tap with, like, it usually ends up being about 2 fingers, and sort of quite firmly, but not to the extent that it actually hurts, but you do want to kind of feel it. And we just tap a few times on each point. You're not counting, doesn't matter how many times, but I'll just go through one round and you can tap with me. So we're going to tap on bladder 2. Those of you who have glasses, a little bit more challenging. Then gallbladder 1 here at the side of the eye. Stomach 2 under the eye on the bone. This is also written out because I kind of give it to patients and people who aren't acupuncturists. So it's got more information. Gallbladder, governing vessel 26, so under the nose. CV24. Kidney 27. And again, you can do both hands or one hand. I tend to tap with one hand, but you can use both hands, one side or the other, doesn't matter. It's a common question. Spleen 21, so under the arm. So I usually just, you can see, I just kind of lift my arm up, tap under there, and top of the head. And then usually after every round of tapping, take a deep breath and release it. Okay, so can we just have a look at what the next slide is? I can't remember now, I haven't got the slides in front of me. Okay, so we don't need that right now. So what I'd like to do, we can kind of come back to the rest of the PowerPoint, but what I'd like, so let's go through that. So one of the things that's very common is that when I've done some tapping with people, and then I say, you know, here are the examples of how you can kind of go away and use it yourself. They say things like, but I don't know what to say. I don't know if I'm doing it right. So the first thing I say to them is, well, you have to start tapping on, even though I have this fear that I'm not getting it right, or even I have this anxiety that I'm not saying the right words. Basically, it doesn't matter what you say as long as it rings true to you. So if we were doing some tapping on just generalized anxiety, maybe even though I'm going round and round in circles with this problem, or I'm just thinking too much, I have all these thoughts in my head, I'm so worried. And you can alternate sort of different statements. And as I said, I love and accept myself anyway is the basic one. But you might say, I choose to relax and feel safe. I'm open to feeling calm and confident. I let go of patterns of behavior that no longer serve me. So there's a whole range of them. And obviously these PowerPoints will be available to you, so you can print them out and use them yourself. What I'd like to do now, I think what would be good, looking at the time, would be, it'd be really nice to actually do some actual tapping. So what I would recommend is if you could, maybe we turn off the PowerPoints and get people to put me on speaker view. And if you put me on speaker view, then you won't be distracted by other people. You will just see me, and then it will be a bit more of a kind of personal, sort of intimate kind of experience. Okay, so a couple of things, because this is a group session and this is the sort of largest group that I have worked with, it's very important that you take responsibility for your own well-being and also your own process. One thing I would say is it's sometimes helpful to have a piece of paper next to you, because if you find that there are certain things that we're tapping on that really resonate with you, or you feel like a really kind of strong reaction maybe in your body or some kind of emotional reaction, note it down, because that's something that you can then work on later on. The other thing to say is that in tapping there's something called borrowing benefits, and that basically means that even if we're tapping on something that isn't directly relevant to you, keep tapping anyway, because it's been found that actually even if you're tapping on things that, you know, are more relevant to somebody else than you, then it will still help you with whatever you're working on in a sort of strange kind of way. And there's something about, I guess we're all very familiar with a kind of group energy and you know, that kind of shared experience. And I think even in a very strange sort of way, my feeling has been when I've been on these Zoom sessions, even though we're all on the ends of our computers, you can really get that feeling still of interconnectedness. And it may not be the best way of how we want to work, but certainly has enabled us to reach out to more people. So it's got an awful lot of advantages. So important things to kind of bear in mind. The other thing is there's something called SUDS, which is rather wordy, and I never always remember what the acronym stands for, but it's Subjective Units of Distress Scale. And for some people, it's quite helpful to give a number to something, and for other people, they don't kind of work that way, and it isn't so helpful. So I'll occasionally bring that in and get you to think about, is there a sort of number of, you know, where you're feeling with this particular issue, or how it's feeling in your body. And then you've got something maybe a little bit more subjective, objective to kind of compare it to. Okay, so what I'd like you to do now is I'm going to get you to just close your eyes and go inwards a little bit, and I'd like you to just focus on your breathing. Now, those of you who do a lot of either meditation or qigong or tai chi or any energy work, you know, might just think, oh, well, no, my breath is always wonderfully deep and goes right down into my belly. But I just want you to observe your breath as it is right now. So again, without judgment, just get a sense of where it is you're breathing from, and whether you're breathing from your throat, upper chest, belly, stomach area, wherever it is. Just notice where you're breathing from. Now I'm going to get you to open your eyes so you can watch what we're doing. And what I suggest that you do is just mirror me. Ideally, some of you may not have privacy where you are, in which case you can kind of just say it to yourself. Ideally, with tapping, we recommend that you say it out loud and you have your eyes open, because it's a way of literally trying to put things out there that have been maybe just, you know, around inside, and, you know, that you haven't been able to release. So it's quite good to kind of just allow it to kind of come out and say it out loud. And also just sometimes hearing yourself saying things, you get a little bit of a different perspective on it as well. Okay, so this is just a simple round of basically focusing on the breathing. And we're going to start off by saying, and again, some of you might not have a constricted breathing, but just say it anyway, because even I notice that when my breath feels quite normal, it changes after doing the tapping. So even though I have this constricted breathing, say it out loud. My breath doesn't feel as deep as it could be. I deeply and completely love and accept myself. Even though my breathing doesn't feel so deep right now. I deeply and completely love and accept myself. Even though I feel this constriction in my breathing. I deeply and completely love and accept myself. So let's go to the points on the face. This constricted breathing. Outside part of the eye. I'm not breathing as deeply as I could be. Under the eye, feeling this constriction in my breathing, this tension in my breathing under the nose, this constricted breathing under the collarbone. I just can't take a full breath. Under the arm, this constricted breathing. Not breathing deeply as I could. And just take a normal breath. Stop the tapping and just again see how that feels. And just notice anything that feels any different. And what I'd like to get you to do now, and say when I do the group sessions, I often get people to literally send me beforehand what are the kind of issues that they feel they want to work on, and I weave that in. But I'm just going to work, when we do the tapping, it's really important ideally to get quite specific. So there'll be times during the session where I'll give you opportunities to maybe fill in the words yourself with whatever feels kind of relevant to you. One of the things that I may preempt some questions, but one of the things that people do ask is, why are we focusing on the negative? And for those of you who've done a lot of affirmations, or those of you who do, law of attraction type work, might find it quite like almost anathema to be focusing on negatives. But the reality is that those negative feelings are there. And if we just put a veneer of positivity on top of them, then we're never really going to get to the heart of what's going on. So even Louise Hay, who wrote You Can Heal Yourself and is known as the kind of queen of affirmations, one of the statements she made once was that, if you want to clean your house, you first have to find the dirt. So rather than sweeping it under the carpet, it's actually about just saying it, identifying it, and hopefully by doing that, also allowing it to kind of go away, or just trying to find what's really underneath that in order to then be able to let it kind of pass through. Because those are the things that often are kind of holding us back, particularly at this time where maybe we want to make changes, or we're being forced to make change and we're somehow really resisting this. So what I'd like you to do again, with this sense of bringing both the physical and the emotional together, is I want you to kind of think about maybe just a particular situation right now that is causing you some anxiety. It may be something like literally this today or this weekend, or it may just be a general thing that's going on. And I want you to again close your eyes and just think about, when you think about that problem, if you're aware of how it makes you feel in your body, if you're aware of anything, any tension anywhere, maybe when you think about it, you have a pre-existing condition and that feels worse. So whatever it is, just let yourself be with that feeling for a moment. Okay, and just open your eyes. And maybe you want to put a number on it. That might be helpful for you in terms of how you're feeling in terms of that tension in your body, or maybe that tension in the pit of your stomach, or maybe a tightness in your neck or shoulders. So if it's helpful for you, 10 would be as bad as it could be, and 0 would be completely free of any tension. Okay, so just going to start with the setup statement. So even though, and let's say you can fill in the words, so even though I'm feeling this tension in this part of my body, when I think about this thing that makes me anxious. I deeply and completely love and accept myself. Even though I can feel this constriction in my body. When I think about this thing that's making me anxious. I deeply and completely love and accept myself. This constriction in my body, connected to this anxiety. I deeply and completely love and accept myself. So going to the face points, open your eyes if you can, this anxiety. Feeling this tension in my body. I just can't stop thinking about it. This worry. Just going round and round in my head. Creating tension in my body. Just goes round and round in circles. I'm not really getting anywhere. I can't help myself. Just go round and round in circles. Okay, and just take a breath in and a breath out. Again, just notice. You may notice that things, you might feel it more, or you might feel a change and something changing by having said those things out loud. So sometimes when you start doing the tapping in, say, if I'm working maybe with a pain-related condition with somebody, I might ask them to tell me what the number is. And then it may be that it's gone, say, from an 8 out of 10 to a 6 out of 10. And then we'll do another round of tapping that says, you know, this tension or this pain in my right back, whatever, is better than it was before, but I can still feel it. Still feeling this pain, but it's getting easier. So you can just do another round of tapping, acknowledging that it's still there, but also acknowledging that it's changed. And usually what happens is that that intensity starts coming down increasingly. And it may be that if it isn't coming down, there's another reason why it isn't coming down, and there's an emotion or something tied into it that one has to work on in order to sort of release before that kind of comes down, because it's often triggers that make those feelings more or less. So it's kind of doing a little bit of explorative work, and it may be that for yourselves when you're doing it, you can just do a little bit of brainstorming about all the things, all the different what we call aspects, because it may be that something changes, but if it hasn't fully gone away, it's because there are certain different aspects for dealing with that. So I was working with somebody a while ago, actually quite a long time ago now, who was actually a friend, and we were on holiday, and he just was talking about having an increasing phobia for heights, fear of heights, and he was starting to really worry that it was affecting how he was with his children, because he was starting to pass on the anxiety to them. And I suggested that we could do a sort of session of tapping, and as we were doing it, he just kept having, like, these memories would just keep coming up, and they were different memories of times when he was in places where he got really anxious about sort of being in a place with a great height. And we just kept working, and in the end we kind of went right back to almost a kind of pre-verbal memory of him. I think he said he thought he was about 2, and he was kind of in Ireland, and they kind of took him, they passed him over to kiss the Blarney Stone, and he was kind of passed over this kind of apparently sort of big height, and he sort of doesn't even have a kind of conscious memory of it. But he basically, we kind of got back to that kind of very early place, and then a couple of days later we went to these very, very deep caves. So it wasn't, we were high up actually because we were over this bridge, but then we went into these caves that he knew very well. But previously when he'd gone into them, he'd have this anxiety feeling, and he felt absolutely fine, and the intensity connected to that Fear had just kind of disappeared. So it can be really, really kind of powerful in terms of breaking. It's not so much the thought, but it's what we call the emotional attachment to the thought that is the thing that often keeps us stuck in a place. I noticed in the chat, just passing through, I might have missed a couple of them. In terms of where you tap, you just tap as many times as you feel like. You don't even have to think about it. You just tap around as you're speaking. And sometimes if you don't even know what words to use, you can just tap on those points, and then if something comes up you can kind of tap on those. So really you can be very kind of flexible with it. So what I'd like to do now is I'd like to just do a round of tapping where I'm going to bring in a few things that have kind of been very relevant for people in the last few months. Some of them may really resonate with you, some may not. So just take note of anything that feels really relevant. And it's almost going to be a little bit of a kind of stream of consciousness. And you'll just sort of see how you can be kind of quite flexible with the tapping. The other thing to say is when you notice that the intensity has come down, then we can start to move away from the negative and towards the positive, which is about opening up the possibility that I might start to feel differently about this particular problem. Okay, so let's just tap, and I'm going to just bring in, a few things that maybe we talked about. Just, you could keep it quite general, like things going round and round in my head, but it's quite good to be quite specific about, well, what actually is it that's going round and round in my head? So I'm just going to say, even though I'm finding it really challenging right now, dealing with all this uncertainty, it's been really challenging over the last few months. Not knowing whether I can work or not work. I'm finding it really hard having to work in a different way. And I deeply and completely love and accept myself. Even though I feel so out of control. All these changes that are being made. Changing from one day to the next. And I deeply and completely love and accept myself. And I'm doing the best that I can. It's been so challenging recently. I've been really anxious about whether I can work. Feeling like I'm having to work harder for less money. And not knowing when I might have to stop working completely. And I deeply and completely love and accept myself. Inside part of the eyebrow, this anxiety. It's all just so uncertain. I'm way outside my comfort zone. Under the eye, and I'm really struggling. And sometimes I just feel overwhelmed. And I'm just finding this uncertainty really challenging. Maybe it's been good not working, but I also really need to earn a living. And maybe other people are relying on me. And it's all out of my control. And sometimes I just feel overwhelmed. Struggling to stay on an even keel. I have all these tools. I should be able to stay calm. That's what I'm always saying to my patients. And sometimes it's just really hard to stay on an even keel. And I'm doing the best that I can in really challenging circumstances. How would it be if I could just go with the flow? Isn't that what we're supposed to be doing with our work? We're acupuncturists. It's all about the flow. But sometimes I just feel really stuck. Maybe I want to make some changes, but I feel really nervous. All these limiting beliefs that are stopping me making change. These fears that I'm either not good enough or that I'm too old. How can I possibly make change now? These fears. Maybe I'd love to do things differently. Maybe I can do things differently. No, I'm a bit scared. I don't have the experience. So many people are doing it already. I just want to carry on doing things the way I was. I don't like working this way. And I'm struggling. Maybe I can do things differently. Maybe change can be exciting. Maybe by letting go of what I know, something new can come in that I don't even know what it is yet. How would it be if I could just be open to the possibility that it will be okay? That I will be okay? That people around me who I love will be okay? Trusting that it will all work out okay. Letting go of all this anxiety. Being in the moment. Appreciating what I have in my life. Hopefully I have enough food. I have a roof over my head. I'm okay. And maybe things will change. And maybe they are different. Trusting that it'll be okay. I will be okay. How would it feel if I just let go of all this anxiety and felt calm in my body? Take a breath in and a breath out. And just see how things feel, anything that you notice. So I'd like to finish the actual practical session with just a little, it comes from, I've been following some of the work of the Heart Math Institute that do a lot of research, so it's really worth looking at their website, and they do a lot of work around looking at what it is to kind of come into our heart center, and just the connection between what goes on in the heart and what goes on in the brain, which I think as acupuncturists, you know, we have lots of theories around where the Shen is, and lots of theories around kind of just that connection very strongly between the heart and the brain. And so I'd like you to just, and this can be a really nice thing to do anyway, at any point, where you just put your hand on your chest and you think about one thing at the moment that's really bothering you, that you just either are having real difficulties with, or that you've been really struggling with, or that have been causing you a lot of anxiety. And I'd like you to think about what would be the opposite of that. How would it feel if either that was resolved, or if you didn't have that feeling? How would it feel in your body? And what I'd like you to do, literally just for a few seconds, is you're going to breathe in that sense of what it is you would like to have, what that quality is, or what something is that would make you feel good in yourself, and what it is you'd like to let go of. And you're going to use the breath to breathe in that positive feeling or that change that you would like, and you're going to breathe out the fear or the anxiety or the negative thing. So just close your eyes and focus on what that is for you. Okay, slowly come back into the room, open your eyes, just see how that feels. Notice anything that you're feeling in your body. So I'm just thinking in terms of, there's a few more slides, but I'm wondering whether it would be helpful to just open things up for questions now, and then I could just go through the rest of the information, a lot of which are actually resources. So should we do that? Just to see if there are, what questions there are, and then we can kind of go back to looking at some of the information on the rest of the slides.
Grand. So if people want to use the participants option, and at the bottom of your participants box, you have the option to raise a hand, or you can type your questions into the chat box.
It may even be, I'm interested if people have got either even just sort of saying something about their experience of what it was like doing that session, anything that they have, any questions in relation to that.
Grand. So the first hand I'm seeing up is from Susan Evans.
Right, I'm just there. Can you hear me? Am I unmuted?
Yeah, we can hear you.
Yeah. Hi, Marion. That was really interesting. I haven't done tapping for many years, and when you were talking us through the bit about not working the way that we used to, and how I just realised when you said I'm not happy working this way, how I'd been pushing that out of the way. And I'm not happy working this way. And suddenly I admitted to myself that I wasn't happy working this way. And that really released a lot of tension then. I felt that was really important to just admit it rather than trying to pretend that I love working in PPE. So thank you.
Yeah. I think what's really important there, Susan, thanks very much for sharing that, is just that thing. It's like, you know, we talk a lot about mindfulness and things like that, and it's actually just being mindful and being aware of what it is that is going on. And even when you say something like, I'm unhappy working this way, it's quite good to sometimes break that down even more and say, well, what aspect of it I'm unhappy about? And even if it's about saying, you know, I don't like working with all this PPE, so to break that down a bit more and say, well, what aspect of it, you know, is it about the fact that you feel that you can't breathe properly under your mask? Is it the fact that you feel that you're not connecting with your patients in the same way? Is it just the fact that it feels very, very clinical and that's not how you kind of work normally? So it's quite good to really, you know, kind of just dig around a little bit and think, okay, well, what does that actually mean? Because you can start off by just saying, even though I feel uncomfortable about working with all this PPE and I'm just really not happy working this way. But the more you kind of get specific, the more you'll also come to what the real heart of the issue is. And then also maybe something will come out of that, it will free up that kind of, it's that thing of when we're really locked in that anxiety, it's very difficult to be creative, and it's very difficult to allow kind of intuition to come up, or just sort of different ways of doing things. But by tapping on that, it may be that you'll realize, oh, well, actually it is something about, you know, that kind of sense of connecting to people. And it's like, well, how can I maybe do that in a different way? And certainly I found, for example, since I've been back in practice, you know, this thing of like not doing the initial consultation in the room with somebody, I found actually doing it on Zoom, where we can see each other face to face without a mask covering most of our faces, has actually been a really helpful way of connecting with somebody who you've not met before, rather than seeing them in the room for the first time. And actually sometimes maybe even just talking about it in the room with somebody, you know, like, well, how's it feeling for you, you know, somebody who maybe you worked with before, and just actually giving space to talk about, you know, what that feels like. In a way, normalizes it, and rather than, as you say, something that you feel like you shouldn't be feeling. Thank you.
Yeah, I was just pushing it away and pretending it wasn't really happening. I just have to do this and that's it. Yeah. You know, and now I'll do some more work on it and drill down what are the real components that is causing me that feeling. So thank you. That was really, really, really useful. Thanks.
Grand. So the next hand raised in the participants box is James Booth. If you'd like to unmute yourself.
Yeah, hi Marianne, thanks very much. Really, really nice session. I had a couple of questions, one of which was, it seemed that some of the points were more awake almost. They resonated much more strongly. And I figured that maybe if I'd focused on those a bit more and moved faster over the other ones, it might have, well, I wondered whether you thought that would have a stronger impact.
I think it's, again, there are no hard and fast rules, although I do remember having an experience of working with a patient who was having not really extreme, but it had sort of depression. And we did some tapping together, which he kind of found helpful in the session. And I was encouraging him to do some more himself. And he was going away and doing it and saying, it's not really doing anything. So I said, well, where are you tapping? And he said, well, I'm just tapping on this one point. And I said, well, why don't you just try moving around all the points that I've sent you the picture of, or in the sequence. And I think sometimes there are times, and I've got a couple of slides that are about insomnia, where maybe where at night it's quite useful to just maybe hold the points rather than tap on them. And it may be that you're in a situation somewhere like in a meeting or somewhere where you don't feel that you can do the tapping, and you can then just gently maybe touch on a particular point. So I would say play around with it. There's no right or wrong.
Mm.
But it may be that sometimes actually the moving around the points is quite good, because actually it's about energy flow and it's about moving chi rather than things being stuck. So you are kind of encouraging that flow by moving around the points. But I think, you know, as acupuncturists, it's quite interesting to notice, are there certain points that are more active in that way? And, you know, even just don't have to do anything, just notice it and see what happens.
Yeah. Okay, thanks. And the second thing was, within the Japanese tradition, I'm sure you're aware of the rhythmic and particular metronomic tapping that Manaka, Dr. Manaka recommended. And I wondered if you'd experimented at all with any different rhythms for the different points.
Yeah. No, I mean, I'm using that a lot with my ontake warm bamboo and, you know, with the Manaka stuff. But I think it would detract at this point, because I think, you know, if you started to have to change your metronome and tap at that rhythm for every single point that you were on, it would kind of detract. And a lot of the more sort of tapping that I've done, and also the more kind of advanced the training I've done, the more you realize that you start off with a kind of basic format, which is the one that I gave at the beginning of the PowerPoint. And the more you can then just start moving away from that script. And I think that the more when you start doing that and it starts to feel more familiar and you feel comfortable doing that, that's when the real intuitive stuff starts to happen. Because sometimes, you know, sometimes I'll do like I did with you on that last session. And it may be, you know, there's a particular person who's I mentioned in the resources, Steve Wells, and he does a lot of, he's got a book called 100% Yes. And he does a lot of kind of work around problem solving and coaching using tapping. So it may be, for example, you have a dilemma between two different issues and you don't really know you know, which way to go with it. And so I've done it with people where literally you just tap on the positive. the positive and the negatives of those things. And then suddenly you kind of find an integration that happens. And I did it with somebody the other day where, you know, she was kind of saying she's a person with a disability, and she kept talking about how her sense of self-esteem is really affected by the fact that everything that is to do with her care needs are about costing. And it was all about the fact that she said, I cost too much. And as we were tapping, we were also tapping on the fact that she, you know, she's an academic, and that she's being asked to do these kind of consultative roles, but that she didn't feel kind of comfortable charging for it. But actually she had all this expertise, and somehow what we came to was the same statement: I cost too much, or not I cost too much, I cost a lot. That's what it was. So it was like, yes, I cost a lot in terms of my care needs, but I cost a lot because actually I'm valuable and people have to kind of pay for my services. So it was kind of turning the statement on its head. So I think, you know, there are ways where literally you just kind of tap on certain things and then just see what kind of comes up. But yeah, I would say if you started to try and do that to a particular rhythm, you would get distracted from, you know, what you could be doing in terms of developing a different type of flow.
Sure. Thank you very much.
Grand. The next one we have is Odette in that participant box, which just so happens to be the name of my grandmother. So if you'd like to unmute yourself, Odette.
Thank you. Yeah, I think it's an old name.
Grand, just like Alan.
Oh, excellent. Just a quick question. I have asthma. I don't know if you have any experience of using EFT during an asthma attack, and what will be the advice for doing it, and also if there is anything like a sequence that is really quick and easy to remember, because during the asthma attack it's just so overwhelming. You don't have the time or the energy or the sequence, right? Sequence that you can do quick and easy, just to help with the anxiety and the breathing and the fear of dying, basically.
Yeah. So, I mean, obviously, first thing to say is you never do tapping instead of, you know, kind of medical intervention that you need. But obviously, in the, you know, in the heat of any moment, you can always do something else as well. And obviously, one thing to say is the more you do tapping, the more it just becomes second nature. So you don't even have to think about it. And you don't have to think about tapping around all the points. But obviously, the classic one is you may just want to tap around kidney 27 or even around lung 1, lung 2 area, because that's a kind of you know, again, a beginning point of a meridian. And it may be that you just say, you know, this fear that I'm going to die. And you can alternate it with this fear that I'm going to die. I'm going to be okay. It's all going to be okay. I'm safe. I'm going to be okay. And, you know, this fear, just acknowledging this fear, and just keep it really simple. Or if that's too much, come down to the Jingwell points, because we also know that those are very helpful in terms of, you know, acute conditions as well. So just keep something kind of moving, whatever it is, and just acknowledge the fear. That's the most important thing, I think. Just like this fear, this anxiety. I can't take a breath, or whatever. And if you can't say it, then just think it.
Just think about it. Yeah.
Just think about it if it's too difficult to actually say in the moment. And if that feels too stimulating, just rub the point. Just hold it. Just hold it.
Right, and if you remember the sequence, then
and I think the thing about this sequence is the more you do it. I mean, when I start off and I try and encourage people to do tapping at home as well, people I've worked with, I send them the routine and I send them a picture with all the points on, and I say just print it out and put it up. But in reality, once you've done it a few times, it just becomes second nature. And if you miss a point, that's fine too.
Right. Okay, thank you so much. So sorry, I joined the meeting quite late, so I don't know if you already mentioned it, but for what I'm reading, it's okay, for what you're saying, it's okay to do both or to do only one.
Yeah, so some people will say, well, it's a bit odd to just focus on one side of the body, so then they would just do both. Obviously for gallbladder, for governing vessel and conception vessel, it's only one, but then you can just go, under the arm is a little bit more difficult, you have to tap both sides, top of the head, so yeah.
Right. And I've noticed you jump from right to left, so it's also okay.
Yeah,
You can
it's
do
fine. It's whatever. Yeah. So you don't, as I said to James, it's almost like the less you think about it, the better. You just do it.
just
I think the most important thing is getting away from this sense about I'm doing it right. And if you're the sort of person like I often am, where it's like, am I doing things right? Am I, doing it the correct way? Then just do a couple of rounds of tapping on, even though I'm always questioning whether I'm doing the right thing. I love and accept myself anyway. I think that a lot of what we work on with tapping is looking at what our self-limiting beliefs are.
Okay, thank you so much. And I suppose as long as you acknowledge the negative feeling,
yeah,
and then you just yourself there, you are fine.
Yeah, exactly.
Okay, thank you so much.
Grand, thanks Odette. And I think that sort of answers a few of the questions that had been building up in the chat box as well about the differences between unilateral and bilateral.
Yeah.
What do the Jing Well points do? I think you've gone over some of these quite well. But if anybody who's written to the chat box still does have a question, just either re-tap it saying no, that didn't quite answer or anything like that. The next we have up is Vina. If you'd like to unmute yourself, Vina. Or type into the chat box. It's up to you, Vina.
Sorry, yeah, just
hello.
Kind of technical wobble.
Not quite. It can take a while.
Hi, Alan. Just to say, I remember we were on the strategy group together, so just a personal hello. But yeah, thank you so much, Marianne, as well. And I just wanted to say, in terms of just a quick thing of the feedback from the experiential thing, it's really great to do that per se, but also to do it with other acupuncturists, because that very thing that you said, which is to focus on the anxieties that we specifically have, that everybody has that about security and finance and jobs and stuff, but your guiding sort of words were really resonated for me, like so many of them. So thank you so much for that, and for that everybody else, for that feeling that I felt connected to you. So that's sort of like a separate point. So yes, Alan, as you mentioned, like the unilateral, bilateral was my question, and it's been answered to some extent, but I just wanted to sort of just share some observational things. And the other thing, it's one thing working with each individual who, or in terms of their experience, for sure. I get what you're saying, Marianne, is to not get too hooked on what getting it right or not, or some regime of doing it orderly and whatnot, that to go with the flow is the best thing with people. But just as acupuncturists, there's just a couple of points, a couple of things, observations really, that I think is that we, within our theory basis, we're aware of the concept of balance. So the left-right balance is something that was in my mind about it. And I sort of thought, so whereas I wouldn't push anybody for that, it doesn't go away for me, even if I was practicing myself. So in the experience aspect of it, what I did was I kind of swapped over just because I knew to do it. And I actually felt like, oh yeah, no, actually that does make a difference, So I kind of value that, sustaining a kind of, awareness of changing the sequences, but, moving left and right. And crossing over, not necessarily, whatever, just that kind of intuitive way that you're suggesting. Then the other thing, and I'll finish with this point, is that I am also aware that the kickoff tap is small intestine 3, and that's indicated for do 14, like the neck issues, and that being the meeting of all yang, that sort of aspect. But also physiologically, it's in the neural system, it's a connection between like the body, top and body, so it's like body, head, body, brain, and left and right. It's like this crossover meeting point. So triggering that as or EFT triggers that as a beginning point. That was very interesting for me. So just wanted to share that with.
I mean, I think obviously as acupuncturists, you know, we'll go off on all sorts of different, you know, kind of trails of thinking about what the relevance is and what isn't. And I know that I'm kind of, that's something that I'm very, you know, that I can quite easily do. And I think for me, the liberating thing about tapping is getting away from a lot of theory and just getting into practice. So yeah, all of these things are relevant. And I think, you know, as some of you have already said, that you've noticed certain differences depending on where you tap, which side, both sides, etc., etc. And yeah, that's going to be relevant and sort of very specific to you, and that's great. And you work with whatever works best for you. But I think the most important thing is, in a way, almost letting go of the theory and just being in the practice. And so much of what tapping is about, which I love, is bringing in, is really, and you know, although, you know, I mean, I'm not a 5-element acupuncturist. I am in terms of meridian therapy, but not in terms of kind of Leamington style. So, you know, for me, the tapping has been a brilliant way of sometimes just going really to the heart of a problem with a patient, in terms of where I've got a real sense that actually their issues are coming from an emotional base that is what's really getting things stuck in their energy system. And the fact that we go back and forth between what, you know, if I'm working with somebody, it's like, okay, what are you feeling now in your body? And literally going back and forth from the physical to the emotional. That's when you start to really sort of see those changes happening. So I would just kind of encourage you to kind of just notice what's going on in the body. You know, if you feel that you don't know what to say, but you're feeling some kind of tightness in your belly, then just work on the tightness on the belly end. It can be, even though I'm feeling this tightness in the belly and I feel this anxiety, but I'm not even sure what I'm anxious about, and I love and accept myself anyway. So, you know, there's lots of different ways, and there's obviously a limit to how much I can kind of go into it. I'm wondering, Alan, whether we can have one more question and then I could just whiz through and even just point what's on the slides, because I don't necessarily need to go into them in detail because they will be available.
Sure, yeah, absolutely.
So just a quick question if there is one.
Yes, I mean, there is a question. There's a hand raised from Michelle Stones. Do you want to take Michelle's question before we...
Well, I'm happy to take a last question, but then it would be nice to have a couple of minutes to just run through.
Absolutely. Okay. So shall we hand that over to Michelle to unmute herself then?
Hi. Hello, Marion.
Hi.
Basically, my question is, I wish I'd listened to this lecture about 2 months ago. Because I've just done a literature critique on looking at chronic PTSD, but looking at it from the perspective of abuse, or where the experiences come from long-term abuse. And my question is around, can using this method help someone control their symptoms when they're at home, they're having intrusive thoughts,
yeah,
they're having the fear, the anxiety, maybe they start disassociating?
Yeah.
Can it be used in that context?
I mean, it's used a lot for PTSD, and there's a lot of information out there. So I would, you know, have a look on the internet and see what's available. But again, I wouldn't get into doing that with somebody yourself unless you're trained, because it really is, you could open a whole huge can of worms. But having said that, you know, somebody like that probably should work with an experienced practitioner who can really help, because there are times where you have this thing called an abreaction, where somebody starts tapping on something and it's like whoosh, it can literally just bring up something really strongly. And you know, and what we do with tapping, which is different from EMDR, is that we don't go into a trauma. We don't actually start to relive a trauma. There are ways of managing that in such a way that somebody can work with the feelings around it without actually going into it. So what we do as if you're working as a practitioner, you're finding a way for that person to manage those feelings and overcome them without actually having to go back into the trauma, and that's really important. So I obviously, you know, I think it can be an amazing tool for people to work with, but somebody in that kind of situation, I think, would really need to work with a professional.
Yes, yes, absolutely.
Yeah. So I'm aware, I mean, it'd be lovely to take more questions, and, you know, I feel like there's so much more I'd love to talk about. Just to let you know, for those people, and it will kind of, my details will be at the end, I'm very happy for you to email me individually. And actually, I have been, one of the things that I did creatively during lockdown, as I say, as well as offering those 3 sessions, just almost as a way of a kind of trial to see how it worked, I have been running a weekly tapping session. And in fact, I was going to stop for all of August. And then I suddenly thought, well, this is crazy. I'm doing this Be Active presentation, and then I'm stopping. So I'm actually going to do one more session this week, which will be on a Thursday at 5 o'clock. I basically charged £10, and it's an hour session. And you know, there's lots and lots of kind of wonderful feedback I've had of how people have found it really, really helpful. So if you'd like to join that session, or if you're not able to and would like to join other sessions in September, I am in the process of changing my website, which will mean that it will be possible to book directly on my site. But at the moment, you have to basically come through me. But even if you just want me to include you in future notifications, I usually send out a MailChimp every week with a little bit of information about the kind of theme for that session, but also we weave in anything that people really want to focus on. And it's like with anything, the more you do the tapping, the more it becomes really sort of helpful and familiar, and is a wonderful sort of self-help tool. And I recommend to people, sometimes even just in the moment, you can do a bit of first aid tapping, where you just do a couple of rounds of tapping. I say to people when they're like when the days when people are at work and feeling really stressed, go to the loo, and in the time it takes you to, you know, go to the toilet, you can kind of just do a couple of rounds of tapping. Or at the beginning and the end of the day, if you want to avoid taking things to bed that might disturb your sleep, just do a bit of clearing with the tapping. Or do 15-20 minutes a couple of times a week, where you can go a little bit deeper, as Susan said, drilling down into what those kind of issues were. So 2 seconds, Alan, can we just whiz through the rest of the PowerPoints? And I'm literally just going to tell you what's on them, because you can look at them and they are kind of self-explanatory. So as I said, that slide number 8 was about I don't know what to say. And I've just given some just examples of things that you can bring in. And the most important thing is that you are specific, and you choose things that you like the sound of, and you can keep changing those. So next slide. I did a couple of slides on insomnia, mainly because, as we know, that's so often tied to when we're feeling very discombobulated, when we're feeling anxious, and often it's that thing of where we haven't dealt with it, and then at nighttime it really comes up. So there's some examples there of things that you can do about just trying to brainstorm, really identify what is it that you're really worrying about, what is it that's most preoccupying you. And then on the next slide, again, there are some just examples of scripts. And what I would recommend is that sometimes you just touch the points at night. You may just choose to touch one point rather than somebody saying that they're not getting the slides now. Don't know what that, whether they're not being able to see them.
Oh, no, your slides were up on the screen, Merit. Yeah, that was just from slightly earlier.
Okay. And then so after that insomnia one, so that's all on there. And then I've just put anyone who's really interested in the research, again, somebody called Dawson Church, who does a lot of work on tapping, has written, there's an article that he's written about all the different areas that tapping is really helpful for. And also there's an example there of a research paper, particularly about tapping used with university students who were shown, I think, literally 15 minutes of tapping, and those are the ones who then carried on using them. Their anxiety scores really came down clinically significantly, and also their grades were higher. So it was kind of just interesting. And then the final page, I think there's a little comment there, unease, anxiety. Oh, forget that. You can leave that one. It's just an Eckhart Tolle little quote about that whole kind of thing of rather than being in the future all the time, trying to come back into the present time, and even just focusing on things that we really appreciate and we do have in our lives right now can help just kind of balance that. Like, you know, we do have food to put on the table, we do have a roof over our head, we do hopefully, you know, have people around us who are well, and if we don't, then hopefully they'll get through it, and just trying to come back to present time. And then the final slide is literally just some resources. There's my contact details if you're interested in the regular tapping group or just want to ask me some questions. And then I put some other resources of other tapping things that are up there that are basically, you know, Brad Yates, I think, has done hundreds and hundreds of YouTube videos, a lot of which are like 10, 15 minutes long, where on any topic pretty much. So you could just go and do a 10-minute session following his tapping routine. And then also details of my training center at the very bottom, Emma Roberts, Sue Beer, who I did my training with. So I think everyone will have access to that information after the session. And as I say, I'm available if anyone needs to contact me. I'm always happy to have feedback, always looking to see how to offer this as a resource and improve on it. So please feel free to contact me. And I think we need to stop there.
Thank you very much, Marion. Just a very quick question. Someone suggested that there was a heart website that you
yes, it's called the Heart Math. So H-E-R-A-R-T, Heart Math is M-A-T-H, Heart Math Institute.
Great, thank you so much. So on behalf of BIC, thank you so much for doing this as part of our campaign for anxiety this month. Much appreciated. And I think from everybody's point of view, a very good presentation and very interesting. So certainly things that we'll be taking away in our lives and hopefully for our practitioners, for their patients for the future.
Okay, lovely. Well, thank you very much for giving me the opportunity to share, and good luck going out there and using it. And yeah, just a little bit at a time, just even a few minutes a day can make a huge difference.
Great.
Okay, thank you
very much.
Nice to see you, some of you. Thanks.
Thank you so much.